You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Last week, I received an email that stopped me in my tracks. A listener wrote, "How can I become a public health entrepreneur when I have no credentials in public health? I can't tell another person what is healthy because I have no authority to do so." Her questions revealed something I hadn't fully addressed, and it's time we talk about it. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines and building businesses that create healthier communities. I want to share something with you today that came up recently in my inbox. I received an email from one of our listeners who really got me thinking. And I realized her questions were probably questions that many of you also have as well. So I want to address it on this episode. Now, in my consulting business on my other podcast, Public Health Epidemiology Conversations, I've been really driven for years about plain language. We really need to be able to explain public health in plain language. It is infused in all of the work that I do for my clients. It's the feature of a episode series that we just started on that other podcast. And it's all around relatable stories, helping people understand what public health really is because public health is so broad. So the fact that this surfaced up here on Public Health Entrepreneurs in this community really caught my attention. All right. So here's what she wrote to me. She said, "How can I become a public health entrepreneur when I have no credentials in public health? I can't tell another person what is healthy because I have no authority to do so. What exactly are you training people to do? Maybe it's the wording for me. Maybe wellness or holistic body, mind, spirit. Public health means to me in the interest of and or on behalf of the public. These two are different concepts for me." So this was the email that she sent to me, and you could just hear her thought process as she was typing this message to me. So I love this email because it's honest, it's thoughtful, and it reveals some really important misconceptions that I want to clear up on this episode. Let me start by explaining what public health actually is, because this is where a lot of the confusion begins. Public health is often misunderstood. So if it hasn't been super clear to you, it's not just you. This has been an ongoing challenge in public health. All right? Public health is the science of keeping entire populations of people healthy. Let me say that again, entire populations. It's about preventing disease, promoting health in all its forms, mental, physical, emotional, encouraging healthy behaviors, and creating safe environments where people live, learn, work, and play. Now, here's what's important to understand. Public health is a specific discipline. People earn degrees in it. They train to do this work in a variety of settings. Many of those people then take their skills into the entrepreneurial world and start consulting businesses or other types of ventures. But, and this is a big but, some people are trained and have developed skills in other fields and still do the work that focuses on population health without obtaining a formal public health degree. They're doing public health work, even if they don't have an MPH or a DRPH after their name. Let me give you an example that this listener brought up. Wellness. Wellness is an area that overlaps significantly with public health. I can easily argue that it is public health. There are entrepreneurs in the wellness space who are absolutely doing public health work. They're promoting healthy behaviors. They're helping populations of people make healthier choices. They're creating environments that support well-being. Even if it appears that their services are delivered one-on-one, they're still targeting a niche population, a niche group. It may be women or specific people within a certain workplace. So the focus is on populations of people. So when she said, how can I become a public health entrepreneur when I have no credentials in public health? I want to address that directly. You don't necessarily need formal credentials in public health to be a public health entrepreneur. What you need is to be doing work that impacts population health in some way. Now, she also said something really important. I can't tell another person what is healthy because I have no authority to do so. And I want to be really clear about this. Being a public health entrepreneur doesn't mean you're telling individual people what to do with their health. That's not what public health is about. Public health is about systems. It's about programs. It's about creating environments and resources that make it easier for people to be healthy. It's about education, advocacy, policy, research, community building. You're not diagnosing disease or prescribing treatments. That's clinical work. You're creating the conditions that allow health to flourish. Think about it this way. If you create a program that helps working mothers find time for movement and stress management, you're doing public health work. If you develop resources that help communities understand nutrition, you're doing public health work. If you advocate for safer playgrounds in underserved neighborhoods, you're doing public health work. If you build a business that provides wellness services to organizations to improve employee health outcomes, you're doing public health work. You're not telling people what to do. You're providing resources, education, support, and systems that empower people to make their own healthy choices. The workshop and the program I offer are specifically for entrepreneurs who already have businesses in this space, the space of public health or overlapping industries. This is not a program that teaches you how to become a health expert or how to get credentials. This is a business program. What I'm teaching is how to prepare your business goals and create an action plan to achieve those goals. It's strategic planning. It's about taking your existing work, whether that's in wellness, holistic health, community health, health education, health technology, whatever it may be, and building a sustainable, successful business around it. If you don't have a business yet, this particular workshop isn't the right fit for you. But if you are an entrepreneur and you have some sort of business that falls in the category of public health or overlapping industry, then this is exactly what you need to move forward strategically. I think what this podcast listener's email really highlights is that we need to have more conversations about what public health entrepreneurship actually looks like. It's such a broad field. It includes health coaches, wellness consultants, people who create health education content, people who develop apps or products that promote healthy behaviors, people who work with organizations on employee wellness, people who do community health advocacy, people who research and consult on health equity issues. The list goes on and on. The common thread is that all of these entrepreneurs are focused on improving the health of populations, not just treating individual patients. They're thinking about prevention, not just intervention. They're building businesses that create healthier communities, healthier workplaces, healthier lives. So if you're listening to this and you're wondering, am I a public health entrepreneur? Ask yourself these questions. Does your work impact the health of groups of people? Are you focused on prevention or health promotion? Are you creating resources, programs, or services that make it easier for people to be healthy? Are you working on the systems level rather than just the individual clinical level? If you answered yes to any of these questions, then yes, you're probably working in the public health space, whether or not you have formal credentials in public health. And here's what I want you to know. Your unique background, your specific expertise, your particular perspective, these are assets. Public health needs people from diverse backgrounds bringing different skills and approaches to the table. We need people who understand business, marketing, technology, education, psychology, nutrition, fitness, community organizing, all of it. You don't have to have public health on your diploma to make a public health impact. You just have to be committed to improving the health of communities and populations, and you have to be willing to build a business that does that work sustainably and effectively. That is what public health entrepreneurship is all about. I'm so grateful to the listener who sent that email because it gave me the opportunity to have this conversation with all of you. If you've ever questioned whether you belong in this space, whether your background is sufficient, or whether you have the authority to do this work, I hope today's episode gave you some clarity and maybe even some permission to see yourself as the public health entrepreneur you already are. Remember, public health entrepreneurship isn't about having the perfect credentials. It's about having the commitment to improve population health and the courage to build a business that makes that impact sustainable. If you're doing work that creates healthier communities, you're exactly where you belong. And if you're ready to take your existing business to the next level with strategic planning and clear goals for your year ahead, the program is available to support you on that journey. You can explore all the details in the show notes and see if it's a right fit for you, for where you are in your business right now. Keep innovating, keep building, and keep making a difference in the health of our communities. Remember that you can always reach out to us directly at publichealthentrepreneurs.com. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.